Okay, why do we floss our teeth? Most patients assume that we floss our teeth to get food particles out. That's not the case. Actually, food particles don't cause a lot of problems between teeth. What causes a problem is plaque. What is plaque? Plaque is an invisible biofilm. It forms in everybody's mouth whether they eat food or not. As a matter of fact, if you're in the hospital being fed intravenously, you still form plaque. So that's why we're flossing, is to get plaque off, not to get food out. It's important to understand that. What does plaque do? It gets under the gum, and toxins in plaque cause inflammation, which cause gum inflammation first of all, and then bone inflammation. The bone inflammation then causes the bone to disappear or resorb, and that forms a pocket. I'm going to go to a chart now to show what this pocket actually looks like. In the top illustration, a dental instrument is shown called a periodontal probe. And the probe is gently placed between the gum and the tooth. And as you see on the top illustration, the measurement below the gum is about 3 millimeters. That's approximately 1/8 of an inch, or the thickness of a coin. That's in healthy gums. The lower illustration shows what happens in periodontal or gum disease, and that is that space, or that sulcus, gets deeper. When it gets deeper, we start calling it a pocket. With a deep pocket, the patient cannot clean at the depth of the pocket. Therefore, the plaque that forms germs that are very, what we call virulent. That means disease forming. These virulent bacteria are very destructive to the what we call attachment apparatus, that is the gum and the bone together. And the pocket gets deeper and deeper, more and more bone is lost, and this is actually what causes bad breath, because deep pockets cause the formation of sulfur gas, and sulfur gas is actually the same gas produced at paper mills. So this is the main cause of bad breath. So to prevent bad breath, and of course to prevent gum disease, keep the plaque off, to keep the pockets from forming, and that keeps periodontal disease from forming. Once a patient gets these deep pockets, they require special treatment. Sometimes we would refer a patient to a periodontist. That's a dentist that specializes in gums. If the disease is not too advanced, we may do some of the treatment here. The treatment may involve a deep cleaning on the teeth. We call that a scale and root plane. If the patient goes to the periodontist, it may require treatment other than a deep cleaning. But the point is, even after gum treatment, the most important therapy is the therapy the patient does on themselves. That's proper brushing and proper flossing. But if you're fortunate enough to have not developed serious periodontal disease and serious bone loss, if you only have gingivitis, that is, if it's only in the gum and not in the bone, then flossing alone may be the real cure. Now, regular dental cleanings are important, but remember, the regular dental cleanings in our office, that gets off the hard deposits in the stain. Hard deposits are also called calculus or tartar. They do need to be removed. However, the real culprit is plaque, because plaque causes the release of the toxins and enzymes that cause inflammation. The reason the calculus or tartar is bad is that it provides it's like a coral reef below the gums, a miniature coral reef, so the plaque has more places to accumulate. So it is important to remove the hard deposits, but the most important thing is to remove the plaque. So that's why we floss. We floss to remove plaque.